You can have depression or PTSD, and they can both exist on their own. Or your depression can actually be caused by your PTSD. But which one is it? Let's talk about it. If this is our first time meeting, thanks for watching this video. And consider subscribing to my channel if you want to learn more about PTSD or mental health. But more important than that, if you're a veteran or a friend of a veteran and you get value out of this video, I ask that you share it with them. Because at the end of the day, all these videos are about is one veteran trying to help another. In this video, I want to talk about the difference between when depression and PTSD exist on their own and when depression is actually just a byproduct of PTSD, and why that is actually important. The reason that I went to school for longer than I would have liked to is to learn how to differentiate between different types of mental health diagnosis. So one of the hardest things to do in mental health care is to actually diagnose somebody properly. And the hard part about it is so many symptoms are part of multiple types of different mental health issues and disorders. Well, that's why I went to school for a long time. And the reason that that is important to properly get a diagnosis, to know actually what is going on, is so we can know how to actually treat you. I can't remember which supervisor over the years actually taught me this, so I forgive whoever that is. But I look at diagnosis like this. Think about a school bus. And you got all these symptoms riding the bus, jumping around, making you stressed out. So you look at every one of the symptoms, sure. You look at all the possible disorders, sure. But what's actually the most important about that bus? It's what's actually driving the bus. Because the driver of the bus is probably what we need to look at first.
Hey, who threw that?
I'll turn this damn bus around. That'll end your precious little field trip pretty damn quick, huh? Shit.
So let's start with PTSD and some of the symptoms. PTSD is a pretty complex disorder. And what I mean by that is it has 20 possible symptoms that you can experience at different levels and frequencies. That makes it both difficult to figure out if you do have PTSD, and sometimes difficult to figure out if you don't have PTSD. PTSD has multiple different symptoms, but usually when we talk about PTSD, we're talking about those intrusive symptoms, so those thoughts and images that come when you don't want them, whether that's during flashbacks or during just thinking about it or during nightmares even. We have the avoidance piece, avoiding certain thoughts and emotions, and also many times avoiding certain people, situations, and even talking about the trauma. Another symptom of PTSD is changes in your mood, changes in the way you are perceiving things. That actually sounds a lot like depression. PTSD can often come along with negative thoughts, you blaming yourself possibly for the trauma, feelings of guilt, shame, feeling low, down in the dumps, or maybe not feeling much at all. Once again, that sounds a lot like depression. After experiencing a trauma, often what we do is we tell ourselves a lot of negative things. I can no longer trust people. I can't trust my own decisions. I'm not safe anywhere. These thoughts often lead to, guess what? Some depressed mood. All right, doc, I hear you. Sounds like I'm depressed and I have PTSD. Well, wait a minute. Let's actually talk about what depression actually is. Contrary to popular opinion, depression is a lot more than just feeling sad. Major depressive disorder, or clinical depression, or depression. A lot of times people just lump all these into the same category. Is not always categorized by feeling sad. Now, often that is part of it. But sometimes people actually feel nothing. Sometimes people struggle with feeling positive emotions like love or happiness. This also happens in PTSD. There's actually a word for this. It's called anhedonia. And if you want to learn more about anhedonia, I made an entire video on it, and I'll link it down in the description. The mood symptoms are a big part of depression, but they're not all of depression. Often, people who are depressed also have trouble sleeping, something also that's involved in PTSD. Maybe they have trouble falling asleep, staying asleep. Maybe they're even sleeping too much. Maybe they're just more slow than they used to be. That actually people can notice. Maybe it's affected their appetite. Maybe they're not eating. Maybe they're eating too much. Maybe they're more irritable. Or maybe they're even having more thoughts about death or wanting to harm or kill themselves. So depression is much more than just feeling sad. Just like PTSD is much more than nightmares and flashbacks. But how do you tell the difference between whether your depression exists on its own and whether your PTSD exists on its own? Or if they're the same thing? 2 tips, and then I'm going to tell you the good news. My first tip in trying to figure this out is to ask yourself, well, when did you start having each symptom? When did you start noticing that you were depressed? When did you start noticing that you weren't sleeping well? When did you start noticing that you were having those thoughts of death? That might be a good clue, because if you started having some of the symptoms of depression prior to your trauma, well, that might be an indicator that we're dealing with depression that's on its own and PTSD that's on its own. My second tip for you is a little bit more complex. It's going to sound like a simple question to ask yourself, but it's really not. What I want to challenge you to ask yourself is, why are you depressed? And what I really mean by that is, where do you feel like this depression came from? What are you saying to yourself that may be causing or influencing this depression? If those thoughts are related to your trauma, if those thoughts are a byproduct of your trauma because of maybe the avoidance that you're doing. Maybe you're depressed because you can no longer do the things that you want to do or that you used to like to do. That may be depression that's actually caused by your trauma, and thus depression that may be a byproduct of PTSD. Dealing with depressive symptoms and PTSD symptoms at the same time is very tricky, because nothing sucks the motivation out of you like depression. At the same time, PTSD makes you want to avoid many things. So it's almost like they feed off each other. When you're depressed, you're not motivated to do things. And when you have PTSD, you don't want to do certain things because you're avoiding the trauma. So I told you there's some good news here though. If we're able to figure out whether your depression or PTSD exists on their own, then we can figure out how to treat you. And here's the great thing about when PTSD and depression are related, and when the depression is a byproduct of the PTSD. If you get treated for PTSD, guess what will happen? The depressive symptoms oftentimes will actually get better too. Almost like you're killing two birds with one stone. So the good news is, and oftentimes this is what happens, because there's only one you. If you get treated for one thing, it actually helps the other thing. And when your depression is related to your trauma, if you do the work for your trauma, if you do the work for your PTSD, you may never have to actually touch that depression. Something to think about.